Welcome back. Smoke-free communities are hot topics these days, and here to tell us more about the benefits of going smoke-free and a campaign to educate Kentuckians in our communities about smoke-free and what it does for your health, we welcome Dr. Ellen Hahn, the director of the Kentucky Center for Smoke-Free Policy. Thank you for being with us today.
Good afternoon.
We know there are some communities that have already passed legislation to go smoke-free. Others are considering it. This is a big issue for our state.
Yes, it is. About almost a third of Kentuckians are covered by good, strong, comprehensive laws covering all workplaces and public places. But that means that two-thirds aren't. So we still have our work cut out for us. But we do have communities that are talking about it. Of course, the state has talked a little bit about it. And we really encourage local communities to have the debate and discuss it because smoke-free saves lives. We know the benefits of smoke-free, does not harm business. We know that by going smoke-free, you can reduce smoking rates. You can also reduce asthma attacks and heart attacks. It really is the best medicine for heart attacks and asthma.
And we have actually a map here that we can show you that kind of gives you an idea of some of the areas based on the strength of their laws and regulations. Tell us about this.
Correct. So the counties in blue have very strong smoke-free laws, and there are about 17 of those. The ones in pink are moderately strong, meaning that all enclosed public places are covered, but not all work sites like factories, etc. And the ones that are yellow have made a step in the right direction, but still quite a few people go to work every day and are still exposed to secondhand smoke.
And with some of those counties, of course, Fayette, where we are now, it has been several years since these laws were enacted.
Right.
And what are you seeing as far as the benefits and the difference it's made in those communities?
Oh, it's made a huge difference, Christy. We've seen a reduction of about 32% in adult smoking, which translates into about $21 million a year in healthcare cost savings, which in these hard economic times is huge. A huge benefit. We've also seen about a 22% reduction in asthma attacks in places that have good comprehensive laws covering all workplaces and public places. We've also seen, we estimate, we have plenty of research now that estimates that in the first year you see about a 15% reduction in heart attack, and after 3 years about a 36% reduction in heart attacks. So like I said, it's one of the best ways that a community can reduce healthcare costs and the burden from smoking and secondhand smoke. You know, secondhand smoke kills. It's a known fact. The science is clear. The debate is over. Secondhand smoke kills, and it's a significant public health issue that we can do something about.
And of course, I know it's a huge effort to educate citizens and communities, governments, and right. There's a campaign that's currently going on to give folks more information. Tell us a little more about that.
It's called Smoke Free Kentucky. It's a coalition of about 60 organizations that have signed on. We're committed to seeing Kentucky go totally smoke-free one day, whenever the legislature is ready and learns the science and takes the time to realize this isn't an emotional issue. But in the same time, we want local communities to keep that momentum going because the more people that are covered, the more lives we'll save. And you can sign up for the coalition by going to smokefreekentucky.org. And you can also get more information about secondhand smoke by going to our website, of course, at kcsp.uky.edu.
Right. And you see the website, you've seen that listed there at the bottom of your screen if you're interested in learning more about Smoke-Free Kentucky. Thank you so much for being with us today.
Thank you.
And thank you for joining us. Enjoy the sunshine before the rain heads in tomorrow. We'll see you again right here at 5:30.